Hi, Tam here. So, whenever I look at the news, I switch on my TV and look at the news, something that's very annoying is that most of the major news outlets, right, they would put a death count that's on the screen 24 hours a day. A coronavirus, a COVID-19 death count. I mean, what's the point in that? I know what's the point. For the media, right? For those news channel doing that, of course, they keep on putting this death count and they update it every few hours so that the viewer keeps on coming back to look at the death count. So for them, it's attracting more viewers, right? And I think news channels, right? News corporations. Look, I've never had much respect for them, but I think now the very little respect I still had for them has basically evaporated, because that's quite disgusting, to be honest. Why? What kind of morbid fixation is that you must update your viewers every hour on the COVID-19 death count? So today they'll say 80,000 people have died already, right? 2 days ago it was 70,000 and then 75,000. Today it's 80,000. Tomorrow it will be 90,000. The day after tomorrow, 100,000. The day after that, 120,000. What's the point? Apart from you getting more viewers and keeping your viewers, to improve your ratings and make more money. But that's irresponsible, And apart from that death count, what you see is not only there is a worldwide death count, but every hour there will be breaking news on the death count. The UK, breaking news, 6,500 deaths. France, breaking news, 10,300 deaths. They've passed the 10,000 mark. The US, breaking news, they've surpassed France, 10,700 deaths. Spain, breaking news, 14,000 deaths. Italy, 17,000 deaths. You see, this is very unhealthy. Half the world, or more than half the world, is already on lockdown. Economies are getting destroyed worldwide. People are anxious. There is a lot of anxiety. So now people are confused. People are scared. People don't know what to believe. There is a lot of news and fake news, information and misinformation and disinformation. A lot of nonsense that's being circulated, and people are afraid. And not only just for health reasons, right? But also from an economic standpoint, millions of people, actually hundreds of millions of people are jobless right now. Companies are furloughing many of the employees. Other companies have just retrenched the employees. Others have just gone bankrupt. Many restaurants and many small enterprises that are in the servicing business, they've tanked. They've gone bankrupt. So you see, there's a lot of anxiety in the world right now. People are worried about their future. Kids are not going to school. It's uncertain times. painful times, it's scary times, you know. I was reading that, you know, some people have killed themselves already, you know, suicide, because they don't see any hope. And now in this environment, here you have the news, the irresponsible news outlet, feeding that anxiety, making it worse with negative stories. 70,000 people are dead already. Today, 80,000 people are dead. This evening, 82,000 people are dead. Stop doing that. You're not helping. You're not contributing. You know, you're not helping anybody here but yourselves. Right? And I think that's pretty disgusting. And you should really take a good look in the mirror and reassess your behavior. You know, if people want to have the numbers, you know, the daily numbers of deaths, they can go to the WHO website. There is a situation summary. With a map of the world, you just click on whatever country you want and you get the numbers that you're looking for. Numbers of tested and infected, tested with positive results, and the number of deaths. But there's no need to run this thing through the news 24 hours a day, man. That's disingenuous. You're just adding to the panic. Yeah. That's the thing. I mean, look, a lot of people are comparing influenza viruses to coronaviruses. And a lot of people are going to jump on and say, yeah, it's very different. Corona is more dangerous. Calm down. This is not about that. You know, first of all, is it more dangerous? You don't know. Influenza kills, on average, 500,000 people a year. We don't have the exact numbers. Could be less, could be more. You know, it's very difficult to know for sure. You know, but the round number, about 500,000 people, 500,000 people a year die of influenza. And what's even worse with influenza, right, as compared to this novel coronavirus, is that influenza kills a lot of children. And that's a tragedy, you know. All the global pandemics of the last 102 years have been caused by an influenza virus. 1918, the biggest global pandemic, influenza global pandemic recorded to date, right? So the 1918 H1N1 pandemic killed more than a quarter of the world population of the time. More than 25% of the human population died. It was an influenza virus, an H1N1. After that, the 1957-58 pandemic, H2N2. More than 1 million people died. After that, it was the 1968 pandemic, H3N2. More than 1 million people killed in a year. And since then, every year, we get about 500,000 people who are killed by the HN viruses, you know, the influenza viruses. I'm saying that to say this. All right, you're putting your corona death count on your screens, right? So everybody that watches the news sees this corona death count and you talk about it every hour and it's breaking news every hour. But then why not put an influenza death count as well? On the average, 50,000 people, 40 to 50,000 people die every single month of influenza. So why not put a counter, a death count as well, an influenza death count. Right now we are in April already, so I don't know where we stand, but we should be way above 100,000 already, right? So why not put the death count as well and say today, the influenza death count is 120,000, tomorrow 122,000, the day after tomorrow 128,000, and we keep on doing this until we reach 500,000 deaths by the end of the year. And you know, I mean, you understand, it's what you're doing is wrong. It's wrong and it's disappointing. You're feeding the anxiety. People are looking for good news. It's not all about bad news. I know bad news makes money in the media, but you know, I mean, there is also good news. For instance, right, talking about this COVID-19 disease. Why not talk more on the news about the fact that more than 80%, not 80%, sorry, more than 90%, 90% of young people with no comorbidities who get infected recover very well and mostly don't even need to go to hospital. The SARS-CoV-2 seems to spare younger people. You should talk about this more on the news. But no, the media will choose to say that, oh, but there is a 25-year-old who died, and there's a 16-year-old who died, and there's a 17-year-old that died. First of all, you don't know what's the situation with these people, you know. Many people have some medical illnesses that they don't know about. Many people have congenital illnesses that they only discover in their teens or in their 20s or sometimes even 30s, you know. Many people are only made aware of a medical condition, of a chronic medical condition, when they go see a doctor for the first time. So it's not even accurate nor responsible to say that, oh, but this 17-year-old had no medical conditions and now she is dead. Irresponsible. Turn it around and talk about the good news. Most young people are unaffected, and when affected, recover very well. "99% of children under the age of 10 recover very well." Actually, I stand to be corrected. I'm going to verify this just now, but I think no child 10 years or younger with no medical condition has died of COVID-19. That's unbelievable. I mean, that's unbelievable. That's wonderful news. Which is not the case with influenza. Influenza, during those influenza pandemics, kids die. Lots of kids die, man, you know? But with this coronavirus, kids seems to be doing much, much better. You know, young people, young adults seems to be doing much better. So that's great news, right? That's very good news. You know, so how about all those people who are going to hospital and are being discharged? You know, you need to talk more about all these positive stories. You know, I liked Idris Elba coming on TV and saying, you know what, I'm COVID-19 positive, but I'm doing well. I'm okay. You know, to Tom Hanks, yes, I've been diagnosed. I'm positive, but you know, I'm doing well. You know, I mean, a lot of people are doing well. Some people are infected; they don't even know they have the disease. Anyway, that's my take on this media coverage. They need to do better. You, the media, need to do better. Cheers.